local knowledge is important. You can bridge scientific evidence, scientific knowledge with their local knowledge, and then you can co-create sustainable community solutions.
How I was working with some of these, multidisciplinary teams, because while you're collaborating, you're working with people from several teams. So what was the experience like in shaping your understanding of One Health research?
First, I would talk about interdisciplinary collaborations, right? Like I'm from human health sector, so I collaborate with animal health sector. You have to understand there is one thing, the best collaboration, it begins with a shared, ideas. You have to share your ideas. You have to be very transparent. You have to share your ideas, your research question, and a very important thing is complementary expertise.
Welcome to the Truth in Research conversation. So this is a conversation that is designed for early career researchers, where we have meaningful conversations that can inspire researchers and individuals who are passionate about making and being part of the policy making decision process, particularly in low and medium income countries. So the reason why we designed this this series of conversation is to expose people who are not opportune to industry experts, and they could get insights that can always help in providing them with the right guidance, particularly for those who don't have access to that guidance. So on our show today, we have Dr. Sweety Suman. She's somebody that is really very much passionate about public health and a doctor. So I'm just going to start, let her introduce herself. So Dr. Sweety, can you please start by introducing yourself? Just take us back to the early parts of your career and how everything started, just tell us.
So hello everyone, I am Dr. Sweety Suman. I'm a medical doctor and a research scientist, and I'm also a founder member of Foundation for Actions and Innovations Towards Health Promotion, FAITH. This is an NGO based in Kolkata, India. Thank you.
All right, so when you look back at your journey, from being a house staff in the general surgery to public health, researcher particularly, and the whole One Health advocate stuff that you're really doing, what was the moment that made you realize that public health was the path where you could create greater impact?
Okay. Actually, see, my transition wasn't about leaving clinical medicine behind. Okay. So it was about expanding my perspective. Now, what clinical medicine taught me? So clinical medicine taught me that how to care for individual patients. Like you were just saying that, I was a house staff in the Department of General Surgery. So clinical specialists, they taught me how to care for individual patients, while public health helped me understand the broader determinants of health, like the social, the environmental, the cultural factors. And honestly speaking, while I was doing my MD community medicine, I was doing my master's in community medicine. So during my 3 years of postgraduate training, I understood one thing, that human health, animal health, and environmental health, these are linked, these are interconnected and interdependent on each other. So it is not possible that only one single sector, like only human health sector, can bring all solutions. So we need environmental sector, we need food and agricultural sector, and we also need animal sector, the vet sector. So One Health naturally, aligned and with this broader perspective, and it recognizes the interconnectedness of human, environment, and animal health.
Yeah, completely true. Because when I look at your background, Dr. Sweety, you're somebody that I've worked across, clinical medicine, and I also realized that I did read up that even the COVID-19 response was part of it, and community medicine, and currently now you're in interdisciplinary research. So was there any specific from what you could think right now, was there any specific experience, during the COVID-19 or during the pandemic, that's the last pandemic, that fundamentally changed how you think about health systems and prevention? Because this is something that is really very important, looking at the fact that we are centering our conversation today around One Health. Was there any experience that you had of such? Can you tell us?
Now, honestly speaking, COVID-19, the pandemic, I think, taught us many things. Everyone, not only me, I learned a lot from the pandemic, honestly speaking. The importance of community engagement, the importance of trust in science. I remember so many misconceptions, misinformation, disinformation were actually, was circulating everywhere. The importance of news media, the importance of social media. We realized, that the importance of news media, importance of social media, and importance of digital technology. How we can actually apply digital technology. Lockdown and everything the situation was really very grave situation, kind of. And one thing I would like to say here, that I was working during COVID-19, and I realized that health systems, cannot work alone. Communities are partners. So without community engagement, we have to consider community as partners and not just beneficiaries, or not just a passive recipients. That is very important. And public health decisions, it really requires collaboration across many sectors. So COVID-19 reminded us that health is interconnected, and that scientific solutions alone are not enough. So multi-sectoral collaboration, risk communication was so important. I learned a lot about risk communication, importance of surveillance, community surveillance. I myself was a part of community surveillance. And last but not the least, preparedness is very important. Very important. So pandemic preparedness is very important.
Yeah, that's true. It's something that is very important. And one of the things that really stood out for me in your profile, was the fact that you're somebody that transitioned from being a frontline public health, from working in the frontline public health, area, to leading research and implementation projects. You don't really see so many people who do that, right? And what was one of the biggest challenges that you feel like that actually you encountered during this transition from being a frontline healthcare worker to now getting into the research implementation field? And how did you really navigate that particular challenge?
Challenges, I would say, it is all about our communication. How actually we have to be very clear. How do we communicate with public? How we communicate with the community members? That is very important. I often see people, they do not go to field. They do not interact with the community members. We have to understand the community members properly, their challenges, their barriers. So I was doing my postgraduate, I was doing my master's in community medicine, and so many public health activities I was engaged with. So actually I really learned a lot. Honestly speaking, community members taught me a lot. I'm not saying that books or teachers, so I haven't learned anything from them, but from my teachers or from books. But this is something I can tell you as a public health professional. Community teaches you a lot. Initially, obviously, you face a lot of challenges. Access problem, that's very important. Particularly if you go to remote areas. If you go to rural and remote areas, very hard to reach population, access is difficult. But then that's a challenge that you can take and you can overcome. And one can overcome those barriers and challenges. So that's very important.
It's very important to understand communication as a challenge a lot of times because as somebody that maybe you stay so much, with patience, and then the next second you're now faced with working on projects. That transition is kind of very intriguing. But then, let's look at this one of your projects. I kind of went through your projects, and one of them, which is quite fascinating, the one you did on bridging traditions, where you're currently co-designing a One Health campaign with Indian tribal school children, by integrating Eastern and Western medicine philosophy. That's really a very fascinating project. So what really inspired this idea, and what did working directly with some of those tribal communities teach you, that traditional academic training could not?
Yes. So, yeah, actually, we received funding of this particular project from the Trinity Challenge, UK. Yeah. Now, about this project, about this campaign, bridging tradition. Now, see, tribal community, they have a very good understanding about interconnectedness of human, animal, environment, the biodiversity conservation, ecosystem conservation. They have a very good idea. Their literacy level is very low. Okay, fine. But the thing is, while I was working with tribal people, one thing I found, they had no idea about what is One Health, what is the term One Health, or some kind of very technical term. They're laymen, so they had no knowledge about what is AMR or antimicrobial resistance or One Health. But the basic interconnectedness of human, animal, environmental, food and agriculture sector, they had a very good idea. That many, the community members, while interviewing, they said that biodiversity conservation, environmental cleanliness, these are very important. Human health is actually dependent on environmental health, biodiversity conservation, ecosystem, environmental cleanliness. They also had a very good idea about, how to deal with, they all have some kind of livestock or the poultry, most of them are actually poultry farmers, or they have hens and chickens in their home, and livestock and goat. So they had a very good idea that, yeah, these are important. Conservation of biodiversity is actually very important. Now see, community, they have a valuable knowledge, but are often excluded. I have seen many researchers, they do not communicate properly, they do not engage community, they have their own knowledge, okay, but are often excluded from designing interventions. First of all, we have to understand we are designing interventions and we are planning to implement interventions among community members, so their participation is very important. We have to understand their basic knowledge, their challenges, their facilitators also. It is not only about understanding challenges and barriers, but also what are the facilitators. Those facilitators are important. You can incorporate in your intervention package. So, but most of the time what happens, the gap is many AMR interventions are designed for communities rather than with communities. Their local knowledge is important. You can bridge scientific evidence, scientific knowledge with their local knowledge, and then you can co-create sustainable community solutions. The solution or the intervention, they will accept. The acceptability is important. Their cultural values, the cultural factors, the social factors, you have to understand it properly. The language.
Of course.
I've seen that many researchers, they think that, I can develop a research protocol and these are my objectives, and I think everything, without going to the community, without interacting with them, they start preparing their tools, they start preparing their, surveys and tools and intervention packages. No, first of all, we have to understand this situation. What is the situation there? Urban community is completely different from rural community. I mean, non-tribal rural community. But the tribal rural community is again different from The other two, India is a very large country, very diverse country. Different areas have their own language, their cultural values, they have their own knowledge, they have their own system. So you have to understand, eastern part of India cannot be same as the western part of India. Not everything cannot be same.
I do,
So,
I do
the
agree.
context specific, the context specific tailoring is important actually. And honestly speaking, real change happens when researchers listen before they intervene. So listening is very important.
Yes, that was very true. And again, if I would even want to add, that's your looking at what you just talked about right now, your AMR intervention project, I think it kind of uses an embedded mixed method design. I also looked
Yes.
at your AMR, and then it also involves community-based action. So now let's look at it from this way now, because I did like, how you described your previous project, where you guys bridged some, traditions and all of that, looking at the diversity in India and all of that. Now let's look at it from this perspective now. For early career researchers now, who are actually listening to my conversation with you today now, what is the most important thing or most important lesson that you have learned about conducting research that is scientifically rigorous and genuinely useful to communities?
And the very first thing, I will start with some basic things, okay, the basic findings. So when I I started working among community members on AMR in the year 2022. Yes, so in tribal areas. But before that, I was working in different communities, but I started working with tribal population 2 to 3 years back. The very first thing I realized, people don't know what is antibiotic, what an antibiotic is. People often do not recognize what an antibiotic is. And not only community members, I found our frontline health workers, some of the frontline health workers, they had no idea about antibiotic. So they used to call me. Yes, when we, the first phase of survey was actually going on, and I got some phone calls from some of the frontline health workers, and they asked me about antacid, okay, some analgesic, the painkillers, analgesic, and they asked that is this an antibiotic? And then they had some prescription, so they said that number one, this one. So what is this, madam? What is this? 1, 2, 3, 4, 5. No, which one is antibiotic? One of our ASHA worker, she called me and she asked, madam, which of these are actually an antibiotic? Now, apart from that, another important lesson which I learned, that knowledge alone does not always change behavior. I have seen people, they have a very good knowledge. They know many things, but they do not practice. If you go and ask them that what preventive measures, infection prevention measures do you know, they have a very good idea, particularly after COVID. COVID taught us about hand washing, about basic hygiene practices. You ask them about sanitizer, they will tell you. So hand washing, mask and everything, they know that we should wear mask, and hand washing is very important. But most of them, they do not perform. And there are different barriers, honestly speaking. In school also, when I visited some schools, I found that they do not have, in fact in tribal community, let me tell you, no source of water actually. So the access to clean water was not there. So apart from that, about rational uses of antibiotics, there were many community members, most of them, they had no idea that what is an antibiotic, how to take antibiotics. But few of them, very few of them, they had that, we should complete the entire course of antibiotic, we should complete the entire course of treatment. But still they missed many doses. So I asked why. Oh, madam, what to say? I was so busy. I had so busy. I was outside. I forgot. I took 4 medicines and I was feeling better. So I stopped. There were some people I stopped.
Yeah.
Now the problem is people lack. I mean, they still, there are many people who do not have any idea about antimicrobial resistance, antibiotic resistance, that antibiotics are not working. People are dying due to antibiotic resistance. So this is a big gap. They feel what will happen? Nothing will happen if we miss 2 or 3 doses. Nothing will happen. What will happen? Nothing will happen. But people should realize there should be a mass awareness campaign that these are the problems. See, when you start working in community, you have to understand one thing. You just cannot go to the community and you will just ask them. You can dump lot of information to them that you have to do this, you have to do this, 1, 2, 3, 4, 5. The important thing is, why will they do that? That why is important. You have to make community members, you have to make people understand that if you do not do this, then these are the problems which will happen. Next time when you fall sick, you will see these medicines are not working. They will not work.
Sure.
You can die. You can have many complications. The economy, the economy itself is a very important issue. People are staying in the hospital. The hospital days, 15 days, 30 days, 2 months, they are staying inside hospitals because medicines are not working. So many lab tests are going on, and you can understand the cost, the expense, the hospital expenses.
Yeah, Dr. Sweety, I must say you've really, you're currently having the career of your life. Like, this is really a very nice career that you're shaping. And, looking at how strong you seem to be performing, particularly in One Health, I've kind of realized, your collaboration with several institutions, particularly the IIT Carib Joe, right? And then there are also some other WHO-linked programs that you've engaged yourself with, the NPTEL, that's the NEPTEL and International Consulting. Yeah. So even the Oxford and all of that, because I've kind of seen the how much you've really developed yourself in terms of collaboration. So if I want to ask you a question right now, how I was working with some of these, multidisciplinary teams, because while you're collaborating, you're working with people from several teams. So what was the experience like in shaping your understanding of One Health research, right?
Yeah, experience regarding collaboration. So first I would talk about interdisciplinary collaborations, right? Like, I'm from human health sector, so I collaborate with animal health sector. And you have to understand there is one thing, the collaboration or the best collaboration, it begins with a shared, ideas. You have to share your ideas. You have to be very transparent. You have to share your ideas, your research question, and a very important thing is complementary expertise. Like, I have a certain experience, I have certain network of people, I have certain practical experiences, but we should always explore what experiences, what networks do other collaborators have. So it is always about complementary expertise. I might have I might be an expert in qualitative and participatory action research or community engagement, but on the opposite, my other collaborators or partners, they are very good in data science, the quantitative data science, the GIS, AI, digital health. So this complementary expertise you have to explore actually. That is very important. And I always believe in long-term relationship. So any partnership or any collaboration should be based on long-term relationship, not like just for a single research or just single study. So that is very important. The sustainability here also, sustainability is important, so that you work with them continuously, you explore evidences, you can have a diverse perspectives. If you collaborate properly, you can have a very diverse perspectives. You can learn many things from them. You can have a stronger evidence. Like India and Nigeria, we are working in India, you are working in a different country, Nigeria. So what happens, we can have a very good, a very stronger evidence, very diverse perspectives. Here there's some, tribal population, they have these are the findings. You can have certain findings in your community. So it is about learning, shared goals, proper communication, transparency, and obviously mutual respect.
Yeah,
Always.
honestly, that is very, very true. And I think I've really learned a lot of things from what you just said right now because, particularly in terms of that complementary experience or expertise, rather,
Yes.
so many
Yes,
people
yes,
look
that's very
down on it.
important.
Exactly. So many people look down on it. They feel like once their organization has the insights, then they don't really need to look outside. So it's always very important for you to also know what is happening up, from the other angle so that it kind of helps. And also, I think collaboration is also something that helps in terms of executing the goal much more faster. Take, for example, there could be an organization, maybe you have the expertise, but you don't have the funding, all right? So, but when you collaborate, it makes things easier for you. And maybe the other organization might bring the funding, then you guys bring the expertise, and then that way
Yes.
everything works out. So I must really say that your insights has really been very meaningful, Dr. Sweety. So one last thing that I would like you to say, particularly in this our very, very, very exciting conversation is, let's say, for example, we have a young researcher in Africa or in India currently, or in an LMIC context, and they came to you and maybe they approached Dr. Sweety and they are like, I want to build a meaningful career in One Health. So probably maybe One Health and public health research, I just put it that way. So, but they don't know where to start. So what would be the first 3 practical steps you're going to advise them to take in the next 12 months?
So before going into details, first of all, I'd like to say to all young researchers, actually not only young researchers, to every researchers, to every public health professionals, I always encourage young researchers to become community champions, not just academic experts. That is very important. Not just AC room activism. You have to go to the community.
True.
Be a community champion, be a One Health champion, be a AMR champion. This is my experience I'm sharing, the most meaningful insights often come from spending time in the field, in the community, listening to communities and understanding the challenges they face every day. Go to the field.
Wow.
And obviously, be curious. Curiosity is important. Go through different literatures, read literatures of different countries, see what is actually happening in globally, what is happening in One Health, in AMR. Learn to collaborate. That is very important. Collaboration is important. Learn to communicate. Because see, you have to understand any activism, campaign or research, it only creates impact when people understand it. So communication is very important. Engage communities. As I told you, communities are partners. We have to consider communities as partners. And very important thing, think beyond publication. Obviously, publication is important, but you have to think about impact. Ask, can this improve health? You have to ask that can your research or your intervention can translate into real world impact. That is very important. Very, very important. See, the health challenges we face today, like AMR, climate change, emerging infectious diseases, food security, they are all connected and they cannot be solved by a single discipline or a country or institution. So global efforts, that is why we always talk about global health. They require collaboration and willingness to learn from one another. So One Health is not just an academic framework. It is something that you have to look beyond traditional boundaries and work together with different collaborators. Engage animal health sector, engage agriculture sector, engage food sector, environmental sector. So that is very important.
Well, thank you so much, Dr. Sweezy. Like, I must say that these insights that you've shared is really very important and timely, particularly for our listeners. Even our listeners who are definitely going to be listening to this conversation in the future, anytime 30 years from now, of course, this is a meaningful conversation that holds water. So, I just want to ask you like two questions, just maybe probably outside of the context. So, will you want to share with our listeners, your best, type of diet?
Best type of
Diet, like that, your best meal, your best African dish.
best African dish.
Yes.
So you're asking me.
Yes.
Actually, I've never been to any African country, but I would love to visit. And I would surely explore opportunities if I can visit. But I'm really sorry. But I think I'll surely be loving, I think, all kinds of food. I'm a non-vegetarian, no issue.
Good. That's great. So thank you very much.
I mean, honestly speaking, please don't mind. I have a very less idea about food and all that of different countries.
That's fine. That's fine. Yeah, sure.
Yeah.
Okay. So, is there any other in one sentence? Any other last thing you might want to tell us? Regarding our conversation right now. Any other last thing or in one sentence that you have for our listeners? Maybe that you want to leave them with, just in one sentence.
Okay, so all the listeners, I think I want to really motivate them. Well, important thing is practical implication is important. You learn theory, you learn a lot, but please go to field, go to the community, you apply that. Okay, and I'm not only talking about the field person or the core community or public health professional. If you are a lab person, if you're a data person, you learn theory, you learn a lot, but you apply it practically, and always keep in mind what positive impact can it have on the society, on the community. That is very important. So whatever you do, yes. So be very clear. Yeah, be very clear about how it is actually going to impact the society, the country as a whole.
Thank you very much for your time, Dr. Sweezy. I must really say, looking at the whole multidisciplinary aspect of this conversation, you've really sent out a very strong message, and I hope this really helps us so much. Thank you so much once more for your time at the Truth in Research conversation, and hopefully we see you again in our next conversation.
Yes, thank you. Thank you so much for inviting me, and honestly speaking, I had a wonderful experience. Thank you so much. Thank you. Let's see in future we can have more activities, more number of activities, more number of public health activities, and we can collaborate and have a very long-term partnership.
Completely, yes. Thank you.